It's 3 in the morning. You are 6 months postpartum, utterly exhausted, yet your eyes are wide open in the dark, straining to hear every single breath your baby takes. The next day, your phone rings with a reminder for your OB/GYN follow-up. Without thinking, you cancel the appointment for the second time this month. Later, while folding laundry or washing a bottle, the delivery room suddenly replays in your mind. The memory arrives completely without warning, bringing a rush of panic that forces you to grip the edge of the counter. People often brush these moments off as standard new parent anxiety, but these intense, exhausting compulsions demand a much closer look. When parents talk about struggling after birth, the medical system and society at large tend to sweep all of those symptoms into a single massive bucket. That bucket is postpartum depression. It is overwhelmingly understood and treated as a condition of low mood, sadness, or a temporary hormonal imbalance. Postpartum depression and postpartum PTSD get talked about like they are one condition. They are not. They are distinct issues driven by completely different mechanisms. Applying generalized depression treatments to trauma behaviors is highly ineffective. It leaves exhausted parents white-knuckling their way through a level of suffering that is entirely treatable. While postpartum depression often brings a crushing weight of sadness and lethargy, postpartum PTSD traces directly back to a perceived threat to life. The origin of that threat is almost always physical. It happens inside the delivery room, a sudden hemorrhage that triggers a panic among the nursing staff, an emergency transfer in an ambulance, a frantic, terrifying stay in the NICU. It also stems from deeply unsettling medical gaslighting, like being repeatedly told to calm down when every instinct in your body knew a medical crisis was unfolding. The resulting trauma is a direct, logical response to an unresolved crisis that happened during birth, not a random flaw in biological hormone regulation. Normally, a memory moves smoothly through the active processing center and gets securely filed away. But during a massive crisis, the memory gets stuck, unable to file properly. Trapped there, it's never tagged as history. Your brain acts like the threat is happening right now. This biological alarm system explains the avoidance. Your brain forces you to skip the OB/GYN follow-up because stepping into a clinic risks triggering a massive full-body alert. It also drives the hypervigilance. You refuse to let yourself sleep because your brain demands you watch the baby breathe to prevent a sudden, catastrophic disaster. These baffling, exhausting behaviors are a perfectly logical neurological response to an improperly processed traumatic event. The old saying that time heals all wounds simply does not apply to PTSD. A broken memory filing system requires active, targeted intervention to fix. Looking back at our memory model, treatments like trauma-focused cognitive behavioral therapy and EMDR are designed to gently guide the stuck memory into the proper filing system. A licensed therapist uses these heavily researched frameworks to help the brain finally categorize the trauma as an event that is safely in the past. When the memory files away correctly, the endless loop breaks. The sudden flashbacks stop, and the nervous system is finally allowed to rest. Resolving this requires specialized clinical tools. Nobody has to simply tough it out alone in the dark. The absolute first step is finding a licensed professional equipped to sort out what is actually happening, separating true trauma responses from the general postpartum umbrella. Coping and Healing Counseling, or CHC, maintains a diverse, culturally competent team of licensed therapists dedicated to doing exactly this across Georgia. They operate 100% through telehealth. You can get specialized care from your living room, anywhere in all 159 counties. Newborn on your lap and all. As you can see on screen, they remove the financial barriers too. Medicaid patients have a $0 copay, and most commercial plans land around $10 to $40 a session. The right diagnosis, paired with accessible professional help, can finally silence the echo of the delivery room and restore a family's peace.